You know you have a bunion that needs surgery or surgery's been recommended. How do we approach that problem? I think any surgeon who performs bunion surgery should have at least half a dozen different ways to handle a bunion. Over the next few minutes I'm going to outline my approach and the logic I try to apply to each and every foot. Every patient's situation is unique, but there are certain basic principles that I think need to be adhered to. And if, as a surgeon, one adheres to those principles, you're likely to get a very good result. Hope this is helpful. Okay, let's talk bunions. How do we think about it? How do I process the information? How do I make recommendations for patients? So when a patient comes in, what they know is their foot hurts, it's difficult to fit in a shoe, and they got a bump on the inside of the foot. So this is the outside of the foot, that's the inside of the foot, this is the right foot, that's the left foot. We can see the bump here. And what's basically happening is that this bone from here down to here, called the first metatarsal, has genetically moved in a direction, this sort of direction. So it's sort of moved in this direction. We don't quite understand how that happens, but that's what happens. This is what I'd consider a mild to moderate bunion, and I'm going to show you a few others. So for me, the decision as to whether to proceed or not depends on how symptomatic the patient is and whether it's worth going through the recovery or not. And you can listen to my video on what a bunion recovery is like to get an idea of that. But this foot is certainly different to this foot, which is different to this foot, which is different to that foot, and certainly different to that foot, being arthritic in that joint. So it would be foolish to think about solving 5 very different feet in exactly the same ways. So I think any surgeon who addresses these problems frequently should have at least half a dozen procedures that he or she does achieve the final goal. So with a relatively straightforward foot like this, what I usually do is shave off the edge, cut the bone over here, fix that with a little dissolvable pin so when you see the next x-ray you won't see any metal, and make another little cut there called an Aiken osteotomy. So that's before, that's after. So you can see how that corrects the foot very nicely. If the angle between this bone and this bone isn't too big, you get an excellent correction. Again, before and after. Here's another patient, similar foot, right foot, angle between the bones, not too bad. Before and after. Shaved off the bump, shifted it over. It's well on its way to being healed at this point. There's a dissolvable pin you can't see there, and there was another little cut there. Before, after. So that gets us a nice correction for a mild to moderate foot. What if the foot's a bit more severe? Take this foot. You can see again the first metatarsal, second metatarsal. And you can see the angle is pretty big. And this thing's called a sesamoid. People often wonder what that is. That's like a little kneecap underneath your big toe that's out of position, and I need to get it back in position. So that's before, that's after. So the procedure is cut the bone at a lower level, closer to this joint, because it's just geometry. If you try to do the first procedure on this foot, it would almost certainly fail. So I do a cut here, I do what's called a chevron procedure, and I have videos on how I do that. She's also got some hammer toes here, which I dealt with at the same time, and I'm trying to make this bone parallel to that bone. So you can see that's nicely achieved. In this case, it's obvious that there's a little metal plate and screws which hold the bones in place until the bones have healed. And then once the bones have healed, the plate doesn't need to be there, but almost always the plate stays in because it tends not to bother patients. So before and after. Here's another example. Similar foot. Left foot in this case. Her right's not too bad. Left, you can see these angles, some hammer toes as well. And after. Again, cut the bone at the base, swing it over, make it nice and parallel to the second metatarsal. Did the hammer toe there as well. And there's a little Aiken osteotomy up there. Before and after. This is another patient who's interesting because you can see She's milder on this side and a little bit more severe on the left side. And this is a before x-ray. So I did a combination of procedures. I did the metal plate correction a little lower on the left side, and I did the distal or the distal chevron Aiken procedure on the right side. So that's before and that's after. You can see we've got a nice correction here. And on this side I could get it all corrected over here. This is a little slightly quicker recovery than this, so if I could always do this, I would, but again, if I tried this procedure on this foot, it would fail. That's before and that's after. Both feet, proximal osteotomy, distal osteotomy, with an Aiken osteotomy on both. Then there's another group. This is a male, and his foot has a very big angle between these two bones. There's some evidence of some looseness of this joint back here. So in his case, I elected to, instead of cutting the bone at the base here, I elected to fuse or weld this joint over here at the same time as I corrected the angle. That's called a lapidus fusion. And then do an Aiken procedure and correct everything there. So that's before and that's after. So you can see there's a metal plate and screws getting all of this to fuse and heal together in a new position. You can see these two bones are nice and parallel, and a little Aiken osteotomy there. This foot was done subsequently as well. So let's go back. So that's before and after. So that's another nice way to do it. My goal is always to do the minimal amount of surgery I can to get the best result possible. Now here's someone, patient who had ignored this foot for years and years. Now she's got a pretty bad bunion on the left, but an extremely bad bunion on the right, and had just managed to accommodate it somehow over the years. And in her case, there are several options, but I decided to fuse this big toe joint. So if you fuse this big toe joint, you can correct all of this and get an excellent durable result, meaning it's highly unlikely to come back. So that's actually the same patient after. So I did her right foot and then subsequently did her left foot. This bone is fused. I could take the metal out now if I wanted to, but it doesn't bother her at all. And she's got a perfectly nice straight foot. So that's a very powerful correction of a foot that has a lot of deformity. A couple of hammer toes had to be corrected as well. Let's go back. So pretty severe deformity, nice correction. And then the last group that I want to talk about is a patient who thinks they have a bunion. The bone's off a little bit there, but it's really that this joint is very arthritic. Compare that joint to that joint, and it's very arthritic. So any attempt to straighten this out and not deal with the joint would be fraught with trouble. If you look on the top of the foot, there's a tremendous bone spur sitting on the top. So that patient also gets a fusion of the big toe joint. So there we go. That's before and that's after. Joint fuses, excellent correction of the alignment. So with those 5 or 6 different operations, we can correct this deformity, this deformity, this deformity, this deformity, and this arthritic big toe. Before, after. Before, after. Before, after. Before, after. Before, after. Before, after. Thanks for watching. I hope it's been helpful. I do think there's a certain logic to the way one should approach bunion surgery, and this video, I hope, outlines how I approach each and every foot. Thank you.